I think if we're talking about, let's use the example of an onset of pain that doesn't have a trauma associated with it.
Mhm.
Where, it's a lot of the patients that we see who have like a slow onset of back pain or shoulder
Yeah.
pain or fill in the blank, whatever you want that to be. We don't actually know with certainty, even if they have imaging, an MRI, X-ray, that the report actually is reflecting what's wrong with them. But yet we say, look at here, here's your facet arthropathy and your degenerative disc. So instead of using that language, we're proposing that you talk about, there's a lot of tissues in your spine. You've got facets, which are the joints. They have a little what's called a synovium in there. There's a capsule, which is part of the joint. There's muscles and tendons and other things in there. All of those tissues are susceptible to load. And so you could potentially have a load problem,
Mm.
where we have, a balance that we're trying to get to, or some kind of a homeostasis. And when tissues can't take more load, they become exhausted. And sometimes we have pain. That's what's manifested out of that scenario. And so I think there's a lot of ways to describe this to a patient without really reinforcing that we believe with 100% certainty
Mhm.
that